Ethics and COVID-19. What are some of the issues? My name's Dr. Jim. Thank you for your time in stopping by for more information and education on coronavirus and numerous topics in healthcare. Healthcare providers have had to make very serious and difficult ethical decisions for many years concerning care issues among certain populations, both here in the United States as well as around the world. Rationing is not a word that most Americans prefer, but it seems to come up more and more frequently amid this coronavirus outbreak. China and Italy have already used extreme rationing, and perhaps Spain and other countries are next in line to make decisions concerning who gets ventilators and other critical care resources. The rationing of care is a very difficult ethical pill to swallow for most of us. Anyone watching cable or network news or browsing online knows that the United States has already begun rationing the testing for COVID-19 as well as critical care resources, and that this practice will continue for some time in the near future. What can be learned from China and from Italy? Well, using China and Italy as examples to learn from, the supply of critical care resources is outstripped by the number of hospitalized patients diagnosed with the viral disease. The most severe form of COVID-19 includes a very dangerous and life-threatening type of pneumonia, which requires admission to an intensive care unit, an ICU, and the use of mechanical ventilation. Ethical dilemmas facing decision makers in America's hospitals include who gets admitted to the ICUs, who is provided the much needed ventilation support. And the ethical issues don't stop at the ICU entrance or with ventilators. While admissions to ICUs and ventilators seem to be some of the toughest and most common ethical decisions that we're hearing about, there are others to consider. For instance, which patients will receive care from hospital staff who are best equipped to handle the current viral crisis? Most medical professionals would agree that their goal is to try and save the most critically ill out there. This is more difficult than it sounds. In order to determine who is sicker than other patients, critical care resources must be managed and screening efforts must be made to determine who is unlikely to need care and who needs to be admitted. Those who are not deemed as sick enough will probably be told to go home and self-quarantine, and probably up to 2 weeks. Here's a concept that we've all heard if you've been in medicine, healthcare long enough. It's not new. Now, this is something that's coming to the forefront. The concept of medical utility. Medical utility is based mainly on scientific assessments and determining which patients, after receiving treatment, are going to improve the quickest, who gets well faster. These decisions must be made efficiently and they must be made quickly, as there will be numerous cases, many people who are going to need to be seen. Before the viral outbreak, let's look at an example. A patient admitted to placed on mechanical ventilation would remain there as long as his or her doctor thought the patient needed to be on that unit. And whatever length of time it took for them to get better is generally what the doctor suggested. This is not the case with the outbreak of COVID-19. If the patient is on ventilation and does not seem to be improving, the doctor may try ventilation on the next patient. These are some of the most unpleasant ethical decisions a doctor is going to have to make. What about test kits? We hear that all the time, every day. Where are the tests? We don't have enough tests. Our country's producing enough tests for us, so on and so forth. Another ethical issue involves the rationing of test kits for the virus, which are in very short supply, although that's changing, again, every day. They're in short supply now and in huge demand. While most people believe that the kits are used to determine if each and every person in a population has the virus, they're actually meant for something else. They're meant to be used to determine public health epidemiology and keeping track of who has COVID-19 and where they live in the country. You know, this one came up recently. Should an entire NBA team be tested versus one single pregnant female in a hospital? And people are getting mad about this. This is an upsetting issue. Doesn't she deserve it? And who gets the tests determines a lot of different, there are many factors that determine who gets the test. For instance, did the NBA players come into contact with far more people as a team and fans and vendors and locker rooms than just one person in the hospital? What is the risk of viral spread because the whole team, was exposed? Locker room, close quarters, sweating, high fives, this, that, and the other thing. Another bundle of ethical issues surrounds the healthcare workforce itself. What about workers in hospitals, ERs, nursing homes? Doctors, nurses, nursing assistants, and others who are now all hands on deck, providing whatever they can in these facilities. They've made the decision to provide care and services for people who need it. If you became a nurse, you know what you were getting into. If you became a doctor, doesn't matter. They would then be ethically bound to care for people diagnosed with COVID-19, right? That's an ethical question. Well, it depends. While they do have an obvious duty to provide care because they chose to, they're the experts. Not everyone is able to handle care. Not everyone is equipped during this crisis. And society counts on them. They entered the healthcare arena knowing that there would be crises to deal with. That's one side. On the other hand, if the care communities, the hospitals, the clinics around the country that they work for don't provide them with personal protective equipment they need to perform their duties safely, we have an ethical problem. We have an ethical dilemma. If the employer cannot provide some level of safety at work, they might be putting everyone at risk. The healthcare professionals on the front line, and then everyone else. Here's some final thoughts. And I'm giving you this ethics talk because, number one, we have hundreds of ethical issues to deal with in healthcare as it is, and in senior care, and dementia care, and mental health, and on and on and on. But now that COVID-19 is here, there might be a whole new batch of ethical problems to deal with. Well, ethical problems are nothing new to me and you. The COVID-19 outbreak across the United States and around the world is making ethical decision making more and more difficult, and in some cases, heartbreaking. Which is more challenging to the brave doctors and nurses who are caring for those infected with this viral disease? Is it the medical treatment that they're delivering itself and the care? Or is it the difficult ethical decisions concerning rationing care, equipment, tests, and working in less than ideal situations? I'm Dr. Jim. Keep coming back. The number of topics, the flow of information, and the speed of change on COVID-19 in the United States and around the world, it's changing rapidly. Keep coming back for more information. And you take care of yourself.